occasion, so இங்க இருக்கிற guests and dignitaries-க்கு ஒரு special வணக்கம் once again. அவங்களால தான் எங்களோட பயணம் இவ்வளோ அழகா எழுந்திருக்கு. So to further welcome you all, I would like to welcome on stage Mr. N. Praveen Kumar, Zonal Business Head, Apollo Spectra Hospital, Chennai.
Namaste, Vanakkam and good morning everyone. To all our respected dignitaries here, esteemed doctors, honored guests, friends from the media and dear colleagues, a very warm welcome to everyone here. It's truly a proud moment for all of us at Apollo Spectra Hospitals. We are gathered here for a special occasion, the official launch of Raphello procedure for treatment of hemorrhoids in South India. As someone who's been part of Apollo's journey, I can say this with heart that when we simplify care, we amplify healing. Today is a reflection of that belief. It is my honor and privilege to welcome Ms. Parvati Nair, our chief guest, a celebrated actress and a symbol of grace and strength. Ms. Rupinder Kaur ma'am, a dynamic chief operating officer and head of secondary care and partner network. Dr. Vijay Agarwal, Director Medical Services at Apollo Health and Lifestyle. Mr. Nishant Mishra, Chief Marketing Officer at Apollo Health and Lifestyle. And our guest of honor and the star of the day, Dr. Vani Vijay ma'am, the healing hands behind this milestone achievement. Dr. Vani Vijay, Senior Consultant, Minimally Invasive and Robotic Surgery. At Apollo, we have always believed in being ahead of curve, not just in medicine, but in also the care that we deliver to our patients. Over 4 decades ago, our respected chairman, Padma Vibhushan, Dr. Pratap C. Reddy, started Apollo with a single mission that to bring world-class healthcare to India. Today, that mission lives on in every corner of Apollo's network, and now right here at Apollo Spectra Hospitals. I would also like to extend my heartfelt thanks to our strongest pillars of support. Without them, this wouldn't be possible. Is Rita Reddy ma'am, Sunita Reddy ma'am, Shobhana Reddy ma'am, and Sangeeta Reddy ma'am. They are our strongest pillars of the entire network of Apollo. With the introduction of Raphello procedure, a minimally invasive solution for hemorrhoids, we are not just embracing innovation, we are also making healing faster, easier, and less painful for our patients, Namma Chennai and beyond. This technique, which has already made a difference across Europe, is now here in South India. Thanks to the relentless pursuit of excellence by our clinicians and our support teams, we are setting a new benchmark in colorectal care. Dr.
Namaste. Good afternoon. Yes, it's 12:02. So good afternoon, everyone. Thank you for being here. Let me first start by acknowledging the presence of Ms. Parvati, our chief guest, our consultant genius in chief, Dr. Vani Vijay, esteemed clinicians, my colleagues from Apollo Spectra, and friends from media. It's an absolute pleasure to be here today as we launch this breakthrough in the advancement of colorectal treatment. So the colorectal program across Apollo Spectra, and with the proctology being the subset of it, has been designed with one common goal, and that is to improve patient lives. Now, if you think about it, this is something that Apollo has been consistently doing over the last 40 years. And I think even when our chairman, Dr. Pratap Reddy, laid the foundation or the brick for the very first hospital in Chennai, the crux of that mission was to improve patient lives, to do things in new ways, to find new ways of delivering healthcare in the country. And with the launch of this new procedure today at Apollo Spectra, we are taking a small step in the same direction. Now, when one thinks about Apollo, yes, Apollo is synonymous with tertiary and quaternary care. We have the large format hospitals which are associated with some really complex surgeries. We have transplants, we have neurosurgery program, we have proton, we take care of cancer. But I think what is not lost on our leadership, and especially our managing director, Dr. Sangeeta Reddy, is that so much of the care is about day-to-day medical problems that it needs a format where the patient necessarily does not have to navigate a very complex environment or necessarily makes it very high acuity patients. So with that, the concept of Apollo Spectra was born around a decade ago, and we are very grateful and humbled that today we have a presence across 22 different locations in India. In Chennai, we have 2 units. One is in Alvarpet and the second one is in MRC Nagar. And the attempt is to provide an environment which is friendlier, it's easy to navigate, very comfortable, and still we have the latest and greatest in the technology available, and our clinical outcomes are on par with any other hospital in the world. Now, coming back to the launch today, I think we all understand how important our health is for our daily peace of mind, convenience, comfort. But we have some of these daily, day-to-day problems that are not often spoken about openly. The perfect example being hemorrhoids, constipation. If you look at the statistics, it is estimated that almost 45 million people in India today suffer from hemorrhoids. And almost 1 million new cases get added every year. And the prevalence of this disease increases with age, and it tends to be highest in the age category of around 45 to 65 years. Now, when you look at these numbers, it's not statistics, these are real people. These are our family members, our friends, our colleagues who are suffering silently. And so why don't we talk about all these issues? Because it's embarrassing. But the truth is, these are real medical problems and they need real medical solution. And that's what we are offering today with the launch of the Referral program at Apollo Spectra. Now, Dr. Vani Vijay is going to talk more about it in detail, but it's a daycare procedure, no cuts, no stitches. Patients go on to have their normal lives in a day or two. And I think if you think about it, one of the key concerns that anyone who has to undergo a procedure has is, one, the fear of the surgery itself, and second, especially if you are a working professional or working mother, working father, how long will it take you to go back to your normal life? So with the launch of this procedure, it takes care of both the concerns. And I think this procedure is also a perfect example of how technology and modern medicine are coming together to take care of the day-to-day issues in a much safer and a convenient way. So in a nutshell, the message today to the community and everyone who's going to be listening about it, reading about it, is that please don't ignore it. Seek help early. In some cases, it can even save a life. If you do suffer from this problem and need a solution, we are here to help with kindness, with expertise, and the best tools available. Thank you very much.
But I think actors go through the most amount of physical and mental stress, because there are so many challenges that we face which we don't even expect. So I think taking care of both physical and mental health are equally important. I believe in regular checkups, regular blood tests, etc. I'm a person who gets paranoid for the smallest thing. So even if there's no issue, I feel like, oh my god, I should do a checkup, because I believe in preventive care. I do not, care about, oh my god, if I go do so many checkups, will people think? No, I think it's absolutely fine. I do eat healthy food. I try to stick to what I think is healthy. My healthy may not be suitable for someone else. The oil that suits me or the ghee that suits me may not suit another person. But you need to try and see what suits you, where you have good digestion. I think if your body digests food properly and your motion is good, everything is good itself, it proves that your digestive system is good and you're healthy. That's a very big thing. So that's the main thing about physical health. And of course, I like to stay active. I do not want to like sit in one place and not do anything. I'm not saying I necessarily work out every day because I have a good metabolism, but I try to stay active, and if they're not very active days, I do want to work out or do something. And with mental health, yes, that's a very challenging question. But all of us try to get better with mental health, and we learn every day, right? So I think keeping yourself calm through every situation is the best thing possible. We get so worried about something on one day, the next day we realize it was nothing. It was not worth going through that stress at all. And I heard and I experienced that there's nothing worse than stress. Like people say alcohol is bad, drinking is bad, this is bad. Stress is worse than everything else. It shows on your face. Even when I've been stressed for a few days, I suddenly see my skin is not the same, I don't look the same, the eyes are sunken. So taking stress is the worst thing for your mental health and physical health, because the mental health affects your physical health. So I think I am trying my best to not see stress in a very painful way, and I think that's one solution I'm trying to figure. So yeah, that is the mental health part. You see things, you try your best and you see how things work out. That's the motto that I follow right now. And don't expect too much from anybody. That's very important in any field for anyone, whether it's your family members, whether it's everybody. Just I think meditation and yoga are great if you're able to do it, and eat healthy food.
Parvati ஏதோ secret சொல்லுவாங்க நாங்க எதிர்பார்த்தோம், but finally she's given us all very practical tips, things that we technically already know. I saw doctor smiling over there. My husband says the same thing. He says you just like to sit in Apollo all the time. So you will find me at the Apollo Spectra in MRC Nagar, myself or with some family member. Whenever there's a small wrinkle or a small issue, the first thing I say is let's go get it checked up. So I'm a little bit guilty of that as well. Yes, that's right. So நீங்க வந்து இந்த preventive healthcare and early intervention பத்தி பேசுனீங்க. So I'm curious, is there a daily habit that you swear by, something you just consistently do every day and you say this helps me?
As soon as I wake up, I drink water. That's the first thing I do. If it's warm water, it's even better. But I make sure I drink water, and that makes a lot of difference to your whole digestion, to your system, to your detox. So I think that water is so important for your body, and because a lot of us don't drink enough water. But when you wake up, if you make this habit of having water,
Ladies and gentlemen, Apollo Spectra introduces the Raffaello procedure. Can we have a big round of applause? Thank you so much. A momentous occasion indeed. Elegant procedure.
and it's one among the comparative treatments which you've had earlier. This would probably take up as the minimally invasive one. I'm just going to take you through a series of less medical jargons, because most of us are not medical professionals here. So I'm trying to make it as easy as possible. Excuse if it's too confusing. Is it working? Sign up to help me? Yeah. I have no conflicts of interest to give you some medical information regarding this new procedure. Please note, there are going to be some pictures, there are going to be some post-operative photographs of our patients with their consent. And if you're not comfortable, you can just skip those slides as we go through. So I think this slide is already covered by our dear Rupinder ma'am. This is a silent epidemic, and 40 million plus Indians do suffer from piles. I would say about 20% of us sitting here, we have had episodes of constipation, we've had episodes of bleeding, discomfort while working because we sit for long hours of work, we travel a lot, we have our occupational hazards, and few women postpartum problems and so much to go. And 1 million new cases every year is not a joke. We need to address this as much as we could. Patients of 30 to 60 years, we have seen most of them have it, and we've also seen more of male patients having this problem compared to the females. Most of us have fear, embarrassment, we don't talk about this, and we're really scared of painful surgeries, whether it's Ayurveda, whether it's allopathy, whether it's any other homeopathy, traditional surgeries, procedures, everything. I'll just talk you through a little bit of medicine here. So these are, this is the rectum and this is the anus. When we have the anal cushions, which is normal for you and me, these swell up due to sitting for a long time, taking travel as a hazard. Those things do give us a little bit of a swelling, which also is normal. Pregnancy is also, during pregnancy, the hemorrhoid cushions swell up, which is also quite normal. And these, when they prolapse and give us some symptoms like pain, bleeding, difficulty in sitting, then we name them as piles. And in our terms, we call it hemorrhoids. இதெல்லாம் கேள்விப்பட்டிருப்பீங்க எல்லாரும் டாக்டர் எனக்கு எந்த ஸ்டேஜ் ஹெமராய்டு இருக்கு எந்த ஸ்டேஜ்ல நான் இருக்கேன் is it too much or is it just beginning அப்படினு இது just a quick picture to understand. There are 4 grades of hemorrhoids, 1 2 3 and 4. I'm not going into the detail. I would allow the clinicians to decide on which grade you have, when you are coming and meeting the physician. So we immediately go to the conservative treatment. YouTube la indha video paakalam, Instagram la indha video paakalam. Edhu panna surgery illama idu pannalam abingiradhu. That's what we all go for as the first attempt. So conservative oh my god, I'm sorry guys. Okay. So in conservative, we first try the diet, we try kadka podi, we try this, we try a lot of water, so much, change our lifestyle, don't go to office, take off a couple of days, then we go for medicines, go to the pharmacy, not even to the doctor, we go to the pharmacy and we pick up whatever the pharmacist gives us, and we think that's going to cure the piles, and some Ayurvedic pills as well, and ointments, allopathy, Ayurveda, everyone has ointments to apply. So that's what we first do before we meet a specialist, which is what I want to highlight, like coming early is the best. This is going to be a run through of traditional treatments from where we were to where we are here as of now. So if you see this traditional treatment, we've had people examining like this, just bend down and see your private parts, how we have to examine, how we go through the pain and suffering at those traditional times. And we have these enemas being given, we have seen paste being applied in the traditional herbs and everything. And this is our famous Hippocrates. He's done it with these kind of blades and knives. Imagine, we are so lucky. We don't know whether we were there in that era, but a device-based procedure where the prolapse of the hemorrhoid is cut and stapled on its own. And this is the pre-Raffaello laser, which I was also a part of practice. It was part of my practice. We have done in Apollo Spectra close to 2,000 cases from 2016 until 24. It's not a joke. It's a very good number. I think Praveen will acknowledge that with us. So this is the laser which we have ourselves done, and now we have moved and upgraded ourselves to this new technique. And we have this fear of pain, bleeding, longer hospital stay, recurrence and incontinence. So doctor, in the surgery panna, piles ko oru prachana vandu, if I am going to undergo a procedure enakku pidippu sakthi irukka, will I be able to pass motion? Will I be ashamed when I step out from my home? This is the biggest fear, and here we are ready to address this. So these are the darts which are not precise, and that's open surgery, that's stapler, and that's laser and other treatments. And what if there was a better way, which is painless, safe, daycare and effective? And that's introducing Raffaello procedure to you. Why is his name even there? Why is it called Raffaello, and who is this person? So let's go with that. It's a very nice mnemonic created. It's a patented technology. It was developed in UK and then practiced in Europe. The name Raffaello is because the RA from radio, F from the frequency, AE from hemorrhoids, and LO from the local anesthesia. So it's a derived name from the actual procedure, and that's why it's called the Raffaello procedure. What is radio frequency itself? Why is it even there? Why are we talking about radio frequency as compared to laser? So in radio frequency, the thermal energy what is delivered, the heat or the energy, the megahertz what's delivered is very high frequency. So ladies and gentlemen, the more higher the frequency, the lesser the tissue damage. So please understand that this works on a 4 megahertz technology as compared to any other technology, so the tissue damage is that much lesser. This technique targets only the diseased area and shrinks, sparing the surrounding tissues. So it's not that in the pakam damage nadakama, if it is a precision like I showed you in the dart. So similar way, only the hemorrhoidal tissue what is targeted helps us and shrinks us. We don't have any cutting it off or any such things happening in this procedure. Who is it suitable for? You, me, nama pakkathu veetu person or edir veedu or office staff. Who's the person who needs this procedure? I showed you the grades, grade 1, grade 2, grade 3 and early grade 4. So late grade 4, they have a huge prolapse and it might be difficult and challenging for the radio frequency to give you 100% cure. And that's when we opt out to the other technologies which are available still, which can give you a relief as well. Raffaello is yet another procedure. It is not the procedure for hemorrhoids. I'd like to highlight this. I wouldn't ridicule laser, I wouldn't ridicule the traditional methods of surgery. Raffaello is yet another procedure in the market which is giving us an excellent precision, less pain and relief. Who we can't operate with this procedure? Patients with aspirin, patients who have had heart disease, who are on heparin, blood thinners. These patients we don't opt for this procedure. How does it work? I'm going to show you a very small video since all of us are now excellently understanding the grades of hemorrhoids. This animated video is from the London clinic because they started this procedure. And you'll be able to understand as I go through the procedure. It's a 30-second video, just bear with me. Hours in Apollo Spectra. The pain is not as bad as the traditional one. Yes, it may have a pain and a discomfort. We wouldn't name it as a pain. We would call it a discomfort, and the recovery would start in 2 to 3 days, whereas the traditional takes about 2 to 3 weeks. So in 0 day, the procedure is done, 1 to 2 days resuming the desk work, 3 to 5 days feeling fully normal, and 21 days we resume workouts. This is also depending a lot on the biology of each patient. This is not a written dictum. Every patient is different, like our 5 fingers are different, so every patient, it's a tailored approach, depends on the anesthesia, depends on the comorbidities they come with, and it also depends upon how the pain threshold for the patient is as well. How do we know this works? The proof of the pudding is in eating it. So I'm going to show you some pictures. If you're not keen on looking at it, just close your eyes. This is before and after. On the table, this happens on our operation table. This is all grade 3, grade 2 and such grades of hemorrhoids which we have treated, and the pictures are taken just after the procedure. So if you see, this is a 1 week follow-up of our patients from the top to bottom, how they have come pre-operatively after the radiofrequency is done and after a week. The healing process is little scientific. I'm just running it through quickly. As I said, the first week is necrosis of the tissue. The second week is the exfoliation, which means the scar peels out. And the third week is your entire shrinking and the healing period. We have coined a term as Raffaello Plus. If people have piles, they also have some pain and bleeding, which means they have a fissure as well. And they might have another disease called fistula as well, if it is infected, if it has any discharge, pus and everything. So we do the same, we do the Raffaello Plus in the same sitting once they come with a different probe, and that is with associated fissure or an associated fistula. What our patients say, if you are here to tell it in front of your eyes, and these are the feedbacks we have in regard to Raffaello, just a few of them to highlight for you. So everyone is talking about Raffaello this entire year in Ahll Spectra. Why is it a game changer? As surgeons, we also think we need some easy stuff to do, we need some quick turnover, we need to see more patients, we don't want to get stuck with the hospital, more number of days to stay in the hospital. So it is easy and quick, clinically proven, because I don't think any doctor would listen to someone if you say this is a new procedure, let's try it. We need evidence. So high patient satisfaction is the key to any doctor, and is economic and efficient. What are the benefits for the patient? Quick relief of symptoms, mild or no bleeding, regional anesthesia, and fast return to daily activity. As I said, the Raffaello Plus, we also deal with fistula and pilonidal sinus with the same Raffaello technique. This is a picture of before and after of our patients. If you see, we would have cut through, you can see a small probe which is on silver the other side and silver here. We used to cut through the entire thing for the fistula surgery, but here we don't have any scar. If you see after, it's just a pink scar which is there after 1 month of our patient. As Ms. Parvati Nair said, awareness is the key, it's very important. Let's talk about piles and encourage early treatment. Is it safe? What is the proof? So we have a lot of scientific papers on this procedure. It's done in UK by one of our professors, Richard Cohen. He's done the first study to prove that this is the safest procedure and it's very effective. This is the second study by one of my mentors, about 3,000 cases in Europe, which has only been taken with the 3rd degree of piles, and our mentorship is with him. This is the 3rd study by my mentor, who is an Indian surgeon. We have done close to 220 cases and a 3-year follow-up and there are only 2 cases of bleeding, recurrence is none, and no other discharge or infection. I would like to share my journey since 1 year, where I have done close to 150 Raffaello procedures thanks to Ahll Spectra and team. This is my journey which started in Indian conference, which triggered my invigorating sense to learn this new technique. And hands-on experience, workshops, training is very important because the learning curve for this technique is not very simple but not very elaborate. But you still need someone to watch over when you're learning something, because patient's life is the key here as a surgeon. After that, I had traveled to the Europe Raffaello Center for the exposure and hands-on training and a certification. It is very important, as I said, learning and certification. So if you are going to opt for this technique, I would advise you to check whether your surgeon or your physician is qualified to perform any procedure on you. I would also like to highlight that I am one of the proctors in the country for this technique, courtesy Ahll Spectra and my team, because we do workshops every 3 to 4 months in Ahll Spectra. And this is one of our first batches we have trained for this procedure. And we also give them observership, hands-on training, and certification. Ahll Spectra also believes in training surgeons, innovations, and skill. We have written a chapter in an Indian authored book. Those who are interested in this procedure, please get it and have a look. Now it's time for some gratitude.